Let's go. Right, now, good afternoon. Ms. Doherty.
Thank you, my Lord. I appear on behalf of Healthcare Improvement Scotland, HIS for short. As the inquiry knows, but the public at large may not, HIS is a body within the NHS in Scotland. It is a national improvement organisation within the Scottish health and social care landscape. Its purpose is to enable the people of Scotland to experience the best quality of health and social care with a specific focus on safety. There is no organisation elsewhere within the UK with an identical combination of functions. HIS uniquely combines a range of statutory duties and other functions, including quality assurance, regulation, service redesign and strategic planning, evidence-based guidelines and standards for health and care professionals and community engagement. HIS works with over 100 partner health and social care organisations, taking a quality management systems approach in a range of different ways to strategically redesign and continually improve services. It provides advice and shares knowledge to enable people to get the best out of the services they use and to help services improve. It provides quality assurance that gives people confidence in services and supports providers to improve, always making the best use of resources. HIS is not a healthcare provider, nor is it responsible for the performance management of any NHS or social care body which provides care. More information about HIS can be found on the HIS website. My Lord, HIS adjusted its work programme dynamically during the pandemic to accelerate some areas of work, refocus some and cease others. These were strategic decisions in the deployment of HIS's workforce aimed both at directly supporting frontline services and at minimising unnecessary pressures at a time of emergency measures. HIS can give an account of its actions in response to the pandemic and the impact upon it of pandemic-related decisions. HIS has a strong interest in both adding to and learning from the additional intelligence that will emerge from the inquiry to inform its future strategic and operational planning. It will be particularly interested in any recommendations made by the inquiry in respect of health and social care improvement, quality management and safety of care. Specifically in relation to the impacts hearing, HIS has arranged to be represented at the hearing for its duration. It appreciates the significant effect the pandemic had on the people of Scotland and will carefully consider all of the evidence given at the impacts hearing and indeed at the inquiry going forward. HIS will assist the inquiry with its work and will work collaboratively with it. Thank you, my Lord.
Thank you, Ms. Doherty. Thank you very much. Now, the next co-participant is Scottish Hazards. Ms. Lindsay.
Good afternoon. My Lord, I represent Scottish Hazards in this inquiry, along with Jim Keegan, KC. Scottish Hazards are a registered charity in Scotland. The primary objective is the advancement of health and safety in the context of occupational health. They seek to provide specialist information, advice, training and in-depth support to workers who do not otherwise have the protection of a recognised trade union. The sectors they assist in is broad and wide-reaching, but includes those within the health and social care sector. The COVID-19 pandemic was one of the most challenging times for workers in Scotland. In particular, those who were considered to be key workers, and even more so for those within our health and social care sector. These workers were the ones who would be attending their workplaces on a day-to-day basis. They could not work from home, and they were the workers that were coming into contact with patients and service users who were either affected with COVID-19 or potentially infected. They were being placed at the biggest risk of contracting COVID-19 due to failings on the part of their employers to protect their health and safety. Workers within this sector made some of the biggest sacrifices in Scotland. Their health was placed at risk due to exposure, and many workers lost their lives. Their families were also placed at risk. Many employees felt frightened of the consequences of the pandemic, both on themselves as individuals and for their own families, and they were looking for somewhere to turn. That's where Scottish Hazards stepped in. Scottish Hazards welcomes both this inquiry and the human rights approach, which has been put at the forefront. Sadly, pandemic planning and response was not approached with the rights of workers in the focus. Therefore, this is a welcome shift. Scottish Hazards are acutely aware of the experiences of the Scottish workforce. Those working within health and social care struggled daily in the same way everyone else did during the pandemic, but they were expected to continue working in an environment that was becoming more unsafe on a daily basis. Those who formed part of the non-unionised workforce who Scottish Hazards assisted were placed at a unique risk as they didn't have anyone to speak up for them. Pre-COVID, for a number of years, Scottish Hazards operated a helpline to offer advice, support and assistance through their casework. As outlined in the written submissions already provided, Scottish Hazards were very proactive in their response to worker safety during the pandemic and sought to shift their helpline to set up a dedicated COVID-19 helpline for vulnerable workers. They provided advice, assistance and, where necessary, took on casework to further employee interests. They dealt with 460 cases, or rather in excess of 460 cases during the pandemic. Each of these cases represented an individual who had experienced a significant issue during the course of their employment during the pandemic. They had nowhere else to turn for assistance, and they sought guidance from Scottish Hazards. Each case represents a story to be told. My Lord, I wish to highlight 4 areas which Scottish Hazards have identified as being key themes from their work during the pandemic. And the first of those relates to Scotland's vulnerable workforce. Scottish Hazards were receiving calls on a regular basis from employees with concerns in relation to their place of work. And this was acute in terms of health and social care. There would often be calls from workers concerned about working conditions, but they felt unable to vocalise this directly to their employers. They were looking for guidance, but they sometimes didn't want Scottish Hazards to contact their employer directly out of fear of reprisal. They were scared to speak up in case they lost their jobs. Scottish Hazards was able to step in and provide a voice to these individuals. During the course of the pandemic, Scottish Hazards reached out to approximately 50 employers to raise issues with them directly and to get matters resolved. Sometimes this had to be done on an anonymous basis out of this fear. The work that Scottish Hazards did during the pandemic gave many workers an avenue to seek the advice they needed. They were giving people a voice. The calls received were from a variety of individuals, many of whom were vulnerable, and that's not just in a clinical sense, but also from those who were some of the most disproportionately impacted upon within our workforce in Scotland, including women, workers of a black and ethnic minority background, those on precarious contracts, such as 0 hours contracts, and the low paid. These were issues that were acutely impacting upon those within the social care sector. These workers were disproportionately impacted upon by COVID-19 due to difficulties in accessing sick pay when they became unwell and due to lack of support by their employers. Scottish Hazards were able to provide guidance and assistance to those vulnerable workers throughout the pandemic. They also did assist the clinically vulnerable within the workforce, where employers were unwilling to accommodate shielding or working from home measures despite government guidance on this. This was a particular issue reported to Scottish Hazards from those working within the social care sector, particularly privately. There were general attitudes of employers in which care workers were expected to go out and do their job as normal, therefore their admin teams should be doing the same. They were essentially disregarding the guidance that was being placed for the safety of workers to suit their own business needs. The second issue, which Scottish Hazards would like to draw to the attention of your Lordship, relates to the lack of consultation with workers on COVID issues and the importance of doing so. Employees were reporting to Scottish Hazards through their helpline that they felt they were not being adequately consulted about changes to working practices throughout the pandemic. For example, Scottish Hazards were aware of casework in which care workers were being asked to increase times spent in service users' homes, moving from providing essential welfare care to full care packages after these care packages had been scaled back as a result of the pandemic. They were then being forced to spend increased amount of times in people's homes with no risk assessments being carried out. There was work that was being regarded as being essential by certain employers, despite this not being the case and being contrary to government guidance. Scottish Hazards were there to assist these individuals. Changes were being made at short notice to employees' working practices, and there was no risk assessments being undertaken. There was a disregard for the views of the employees, which was causing increased fears, insecurities, anxieties, and uncertainty. All of this leading to work-related stress and mental health issues for employees. Scottish Hazards consider that there was a serious lack of engagement and consultation with workers when employers were considering, planning, and implementing COVID-19 control measures within the workplace. The impact was significant on employees. Without hearing the views and concerns of the frontline workers in relation to these control measures, employers were failing to adequately identify COVID-related hazards, resulting in unnecessary exposure of workers to COVID-19 and illness. This would then have a knock-on effect upon the service users they were attending to. The lack of communication by employers resulted in fear about this increased exposure, and that would lead to these people seeking out advice from Scottish Hazards. Third, my Lord, it has to be highlighted that there was a lack of workplace control measures and mitigation to reduce exposure to COVID-19. Health and social care workers were placed in a difficult situation in respect of access to personal protective equipment. The issues in relation to access to PPE was widely reported in the press, particularly with issues surrounding procurement and the improper issuing of contracts. The issue to care workers on the ground was far more pressing, though. They needed access to this equipment and they weren't able to get it, irrespective of who was being instructed to provide it. It's easy to get drawn into the political discussions regarding these decision-making, but I don't think that's the appropriate time for that, and hopefully that will come during the course of this inquiry. As a result of these shortages, health and social care workers were being left with no PPE, being required to reuse PPE or use inappropriate PPE, and risk their own health whilst doing so. This is a serious issue which must be considered during the course of this inquiry. Employees were also highlighting to Scottish Hazards issues in relation to ventilation within their workplace. They had concerns regarding transportation, for example, care workers having to use public transport to visit multiple service users, with little regard to both the risk to them as an individual and the risk to the service users they were visiting. You then take a step back further and look at the risk to the public at large. These things were disregarded. All of these made working within a health and social care sector for an employee more challenging and leading them to seek assistance from organisations such as Scottish Hazards. The fourth matter, which Scottish Hazards wished to highlight at this time, was the lack of enforcement in the broadest sense regarding the enforcement of laws and statutory guidance. Scottish Hazards do not consider that all employers within health and social care were taking the guidance and laws issued seriously. They were trying to bend the rules, so to speak, to suit their business needs, with a complete disregard for their employees. This was a particular issue within some private social care settings. It's another flagrant disregard for the rights of the employee. The Scottish Government used devolved public health powers to issue far-reaching measures that impacted on the safety of workers, which was welcomed. But they did not introduce adequate means to ensure those measures were being followed. Adequate penalties should have been included in the response, together with a way of policing the breaches. In addition, the Scottish Government guidance could have gone further in referencing, highlighting and stating the existing legal requirements placed on employers. For example, the need to adequately risk assess. It's a well-established principle within our law that was not being undertaken. Scottish Hazards bring an important perspective to the inquiry, which they hope will be of assistance in undertaking the terms of reference. First, they are able to provide evidence to the inquiry from those who don't feel able to speak for themselves. As indicated, Scottish Hazards collected information on the cases they worked on throughout the pandemic. They're able to share these case reports to ensure that no individual story is omitted. They'll be able to provide evidence from this casework, which shows some of the issues that have been mentioned this afternoon. These are only touching the surface of the experience of the non-unionised workforce in Scotland. Scottish Hazards can and shall assist the inquiry in ensuring the voices of workers who feel they cannot speak for themselves are heard. Secondly, Scottish Hazards were significantly involved in the Scottish Government COVID Safer Workplaces Advisory Group. This group was set up in March of 2020 by the Scottish Government. Scottish Hazards sat as part of this group, and they'll be able to share their experience of involvement in the group from a non-unionised workforce perspective. The advisory group provided a platform for discussion and an opportunity for Scottish Hazards to raise the concerns of those on the front line who had been forgotten about by their employers. Scottish Hazards would like to see the Safer Workplaces Advisory Group continue. There needs to be ongoing work done to ensure that the country is prepared in the event of a further pandemic. This valuable line of communication with the Scottish Government by way of the advisory group ensured that those who were not represented by a trade union were still included in that discussion. In considering the assistance that Scottish Hazards can give to the inquiry directly, 2 witnesses have been identified at this stage. The first of those is Ian Tasker, the Chief Executive of Scottish Hazards, and the second is Cathy Jenkins, Trustee of Scottish Hazards. Both witnesses would be available, if called upon by the inquiry, to provide experiences of non-unionised workers in Scotland. Such evidence would assist the inquiry in better understanding the perspective of health and social care workers. Scottish Hazards welcomes the commencement of this inquiry and are grateful to the inquiry both for their core participant status and for the opportunity to address the inquiry this afternoon. It's hoped that Scottish Hazards are able to assist the inquiry in fulfilling their terms of reference, and it's hoped that there shall be acknowledgement given to workers in all sectors for the sacrifices made during the COVID-19 pandemic to ensure that the vital services of Scotland continued. Scottish Hazards would like to see the inquiry assist in the furtherance of workers' rights in line with the categories of the terms of reference. The lack of preparation for this pandemic led to strain on the part of employers and employees rather. This additional strain contributed not only to the difficulties in being part of the workforce, but also to their health. Scottish Hazards played a part in assisting those who didn't have anyone else to help. COVID-19 has had a devastating impact on the health of some of those who contracted the disease, and particularly those who have suffered from long COVID. The pandemic was treated only as a public health emergency, and Scottish Hazards is of the view that COVID-19 should also be regarded as an occupational health matter for those who caught COVID-19 during the course of their employment. Recognition of long COVID as an occupational disease would allow workers to access various different benefits, such as industrial injuries benefits. And Scottish Hazards hope that the inquiry will give consideration of that as far as it is allowed within the terms of reference. To conclude, my Lord, it is essential that lessons are learned from this inquiry to ensure the protection of workers' rights. It is essential that future plans and pandemic planning consider the workforce in Scotland. They cannot be forgotten about again. Scottish Hazards hopes to assist the inquiry in any way they can and will provide any information required to do so. Thank you.
Thank you very much, Ms. Lindsay. And lastly today, the Scottish Trade Union Congress. Mr. Keegan.
Thank you, my lord. I appear with Miss Lindsay on behalf of the STUC. The STUC, as most of us know, is the independent body to which individual trade unions in Scotland affiliate their Scottish membership. And it represents collectively over 550,000 trade union members in Scotland. As this is the first substantive hearing of this Scottish inquiry, it's appropriate that we acknowledge immediately the very great sacrifice made by so many workers and their families in this pandemic. The STUC represents the collective voice of workers in Scotland. It's a key civic organisation that has engaged with successive Scottish governments since 1999. It is therefore uniquely able to gather information, offer advice because of its representative structures that cover and disseminate advice throughout public and private voluntary healthcare sectors in Scotland. It is able to receive direct reporting and feedback from key workers delivering essential services, and it was involved in the establishment of the COVID group that met with the Scottish Government. Evidence will be given about the engagement between the STUC and the Scottish Government and about concerns that were communicated to the Scottish Government about levels of consultation and response by employers to the crisis caused by COVID. Failures in the provision of PPE to a range of workers in health and social care, failures in setting up maintenance of an effective supply chain of PPE and associated equipment, inconsistency in planning and provision to protect workers in high-risk groups, such as those with underlying health issues, disabled workers, Black, Asian and minority workers, and ensuring that the system of testing and protecting was not hampered by employers failing to support workers to self-isolate without incurring financial loss. COVID group meetings continued throughout the pandemic until March 2022, and throughout that time the STUC and its affiliates were able to identify and raise concern and report issues of potential breaches of guidance and regulations by employers, thereby providing government with a valuable insight into the risks posed to key workers in carrying out their health and social care roles. Workers and their families faced huge challenges in their private and working lives during the pandemic. The working population was significantly impacted, either by being forced to work from home, by being deprived of the ability to work and earn, or by finding itself in the forefront of the response in providing health and social care in transport, in retail, including pharmacies, and education. People were hampered by shortages, access to services, by restrictions placed on travel and social interaction, and by lockdown. Some had to live in their places of work, and at every level, people found themselves fearful of risk of contracting the disease, but were often placed at increased risk from the disease itself, together with the stress and pressure of everyday living, studying, and working through a public health crisis of mammoth proportions. Workers in health and social care were in the front line of this national emergency. So it's of paramount importance to acknowledge and understand the fear that would have been felt by many as they strived to provide care to patients and clients, to disabled people and the elderly, despite the known and as yet unknown risks that they faced. As death rates surged, our frontline health and social care workers who were doing their best to preserve safety and life inevitably sustained a very significant toll on their own lives, health and well-being. We can now see that, in addition to the tragic early deaths, there has also been a significant toll on family lives impacted by long-term mental health issues, financial issues, and relationship breakdowns, the cause of which was often exhaustion, disillusionment, and burnout. This has been the outcome for many that soldiered on through all the challenges, notwithstanding that they had to cope with bereavement in their own families, among their colleagues and friends, and labour under daily fear that they could be next to lose their lives. It's self-evident that COVID-19 is a public health issue, but it is not just a public health issue. It is an occupational health issue that constitutes the single greatest threat to occupational health and well-being in Scotland for decades. By the beginning of 2022, there had been well over 1 million COVID cases in Scotland and over 12,000 deaths following a positive test for the virus. COVID cases and the death toll continued to rise, but have been mitigated by the vaccine programme. Long COVID is one of the many outcomes that is also rising and is self-evidently, I say, an occupational health issue. It is an issue that impacts on workers in health and social care. It should be recognised as an occupational health issue by governments, enforcement bodies and employers. COVID and long COVID are not just community-based concerns. Evidence shows that COVID was, for a significant portion of the population, contracted and spread within places of work. That phenomenon was not recognised and continues to be ignored. Evidence will demonstrate widespread failure to report workplace-related outbreaks, continuing related illness, and death. Evidence will demonstrate that failures to record such events, inspect suspect workplaces, and make targeted interventions increase the risk of exposure to the virus. Evidence will show that unnecessary exposure to risk has resulted in ill health, in many terms long-term, for workers, their families, and those being cared for, and financial losses for workers and their families. The failure or refusal of governments to recognise the occupational health risk that is constituted by COVID has the effect of denying the opportunity for practical legal redress. Deficiencies in pandemic planning and resilience continues to have a significant impact on day-to-day life and work in Scotland. I consider that it is necessary to look at the malign impact of austerity and Scotland's ability to effectively implement planning and readiness for a pandemic during the decade that preceded COVID. Pandemic planning in Scotland and indeed the UK was predominantly focused on influenza-type viruses. This is concerning because the existence of coronavirus was already known about. Such outbreaks occurred in 2002, SARS, 2009 swine flu, 2012 MERS. Exercise Silver Swan was delivered during the latter part of 2015 as a series of tabletop exercises across Scotland that focused on health and social care, excess deaths, business continuity and coordination. The report was published in April 2016, and the key findings can be found in page 9 of that report. And I've mentioned in my statement, I don't need to read it out, that part of the report. Evidence will demonstrate that underfunding in health and social care caused by austerity had a significant adverse effect on planning and readiness for the COVID emergency. Preparation requires not only planning, but also the capacity in public services in health and social care. Public services are greatly diminished and weakened by years of budget cuts that impacted on the ability of our national and local governments to respond quickly and effectively to the sudden and devastating shock of a national emergency that has been COVID-19. The initial response to COVID-19 also failed to consider and recognise the potential for aerosol transmission of the virus, so that the health measures initially put in place focused on other precautions such as hand washing, rather than on the provision of equipment such as masks for general public and PPE for frontline workers. That was the case, notwithstanding recommendations that derived from UK exercises that took place in 2016 and 2018, in particular Cygnus and Iris, about stockpiling PPE and the provision of training in the use thereof. The trade union affiliates that are represented under the banner of the STUC are all able to bear witness to the impact of what can only be described as a lack of preparedness in every facet of life and government for the pandemic. The STUC intends to highlight the effects of this lack of preparedness on workers and their families in Scotland. Evidence shows that from the outset, the COVID-19 pandemic, workers in health and social care immediately experienced a number of significant issues in the provision of care and the impact on them physically and mentally and socially, as a high percentage of female workforce providing frontline care during such an extraordinary situation, which the government, National Health Service, local authorities and private and third sector employers were evidently ill prepared for. That placed a substantial strain on all aspects of family life, including but not limited to childcare, and in making provision for childcare with relatives, all at great risks, so that health and social care workers could just carry out their critical roles as key workers, and many have not recovered from the stress and strain that this brought to them. One clear example of the lack of preparedness has been the substantial number of problems that were associated with the provision and access to supplies of PPE, and the absence of guidance to workers and how best to protect themselves and others from the exposure and spread of the COVID virus. It was immediately apparent that the high level of uncertainty and anxiety put immense pressure on all areas of the health and social care workforce to access face masks and other protective clothing to attempt to adopt social distancing. The practical difficulties associated with that created widespread anxiety and impacted substantially on ability to avoid contracting and transmitting the virus. At all sectors of the health and social care system, workers encountered delays in receiving adequate supplies. Some PPE had to be reused, causing risk to the wearer and to others. There were fears about engaging with fellow workers, patients, clients, and members of the public who did not have or could not wear masks or PPE. The inclusion of face shields in PPE provision were thought to provide a higher level of protection, but they were less accessible. PPE was rationed, and issues arose with accessing or achieving appropriate PPE fittings. Advice and provision were often cost or supply driven, as opposed to being based on the highest level of protection. Instructions with some PPE weren't even in English, which caused confusion and a lack of confidence about their correct use. And some PPE supplied to workers was out of date. The quality of supplies was variable. Guidance associated with the use of PPE was mostly focused on providing care in acute hospital settings, and health and social care workers out with those settings and those in the community were vulnerable due to the lack of clear advice and equipment to protect themselves. Health and social care workers had to work in uncontrolled settings in homes where there was no control over ventilation. I'm talking about private homes. Access to washing facilities, numbers of people present, and overall conditions. Workers providing home care services did not have guaranteed access to appropriate rest areas, or to the ability to prepare food, drinks for prolonged periods of work. The vast majority of health and social care workers take their uniforms home to wash them. However, the unknown risk of cross-infection caused them to worry about what might ensue from taking their clothes home, washing them with other clothes, being able to launder things on a reasonable basis without risk. The absence of any guidance on this, amongst other things, added further to the stress that workers experienced. Evidence about experience in almost all areas of working lives can be demonstrated in the impact summaries and statements that have been prepared for the S2UC and by the S2UC. And when I say for the S2UC, I'm talking about its affiliates. There are some examples that I can briefly go to because I see time's marching on. But there were some workers who had to work within a bubble, and I heard that mentioned earlier. But some people actually did separate themselves from their families and worked within nursing homes in order to provide care, so that they were separated from their loved ones for long periods. But that didn't improve their access to decent wages in the aftermath. Other workers had to cope with transport issues that exposed them to greater risk with the disease itself and in contracting it. Other evidence will show a disproportionate impact on ethnic minority groups within the health and social care sector. And this should have been avoidable, but failures to recognise and provide guidance about higher potential risk groups, such as those with comorbid health issues and BAME workers, left them exposed. Whilst other parts of the NHS locked down and minimised direct contact with patients, most workers in health and social care had to be in daily contact with the public, whether that was travelling to work or delivering care to the needy. GP patients who didn't have access to the GP practice or to A&E often transferred to local pharmacies, and that increased the workload for pharmacists, and that in turn caused difficulties within the pharmacies in which they worked. And within 2 minutes, thank you. Within these pharmacies, there was also a lack of PPE. I give these things, obviously, as examples. But one thing I want to stress upon, I think, are stressed today, is the complex situation which is faced by those who are experiencing long COVID conditions and the impact that that has caused on workers. And the S2UC will provide evidence about that long-term impact on workers, on their families, on their jobs, and on their ability to continue to perform their daily lives and jobs. The opening statement I've given is brief here. It's longer in print, but it provides only a brief overview of the level of experience that has been which has impacted on workers throughout this pandemic. The S2UC has a wealth of experience that it can offer to this inquiry of the impact of experiences and of the shortcomings in government responses. And I hope that the inquiry will listen carefully to everything that will be on offer and take it on board in making its final recommendations. I'm sorry that this is much longer than it should have been, but there we go.
Very good. Thank you, Mr. Keegan. That brings us to an end of, actually, the opening submissions. As you know, we're not sitting tomorrow, and that is because a number of co-participants and their representatives require to attend hearings of the UK inquiry in London tomorrow. And in the cooperation that's been shown between us, we're assisting by not sitting tomorrow, but we're back on Friday, where we will actually start evidence. So I look forward to seeing you all at 10 o'clock on Friday morning. Thank you.